Hello and welcome to this first video lecture that is going to introduce assessment. We're going to first review why we assess, why we do that in the first place. Why is assessment important in counseling? I think I'll first share with you my experience of assessment. It's been part of every clinical experience that I have had over the course of my career, beginning with my work at a school for children with significant disabilities. I was at the time implementing behavior plans, and for those of you who've had experience doing behavior therapy, you know that collecting data on whether or not your behavior plan is effective is a core component of behavioral intervention. Next, I volunteered at a crisis hotline and was conducting suicide assessments using a structured protocol, and we basically were assessing whether or not the client was high risk enough to warrant a call to 911. I then worked for 6 years at a child and adolescent inpatient psychiatric unit where I was conducting daily safety contracting and also completed the mental status exam on every patient that I was assigned for that day. When a patient was near discharge, I also administered the Columbia Suicide Scale, and this was used primarily to assess for lethality and non-suicidality because the hospital was concerned about their negligence, being at least charged with negligence if they had discharged the patient before they were truly ready to go home. I also used assessment informally during my work as a family therapist. For example, I used parent-child sand tray. It's a variant of sand tray therapy from play therapy, whereby I would have the parent and child interact together in play using sand tray, and I would assess their interactional dynamic. I found this actually quite useful, and I'll give you a clinical example of why so. I once had a 5-year-old boy who was acting out at home, and his mother, during the play, it became very apparent that she was fairly depressed, despondent, detached, and it became a major clinical issue to work on the mother's own depression because we thought that if the mother could be more engaged, then her child was going to reduce his acting out behavior at home, which we believed was a cry for attention. I also, while I was at the hospital, learnt to administer and score and interpret a variety of more in-depth, comprehensive psychological assessments, some of the more famous ones, including the MMPI, also including the Rorschach, the thematic apperception test, the Beck inventories, all of which you'll learn a little bit more about in this course. When I was a school counseling intern, I was charged with conducting behavioral observations. For example, I would sit in classrooms with children who were having behavioral difficulties, often with ADHD or autism, and determine what kinds of supports, accommodations, if you will, the child needed in order to be successful in the school environment. And then when I've been working in private practice, I've been using things like the outcomes rating scale and the session rating scale along with the symptoms checklist in order to assess progress and also to do screening for clients coming into therapy. So I've had a variety of assessment experiences like most clinicians, and I believe that based on my own experience, assessment is really a core counseling skill. It's something that has been part of every counseling job that I've had. I think your experience in this course is going to be challenging. I think that this course naturally is going to force you to face some quite difficult experiences, such as assessing clients when it's not completely clear what's going on and you have to make some clinical judgments, some decisions. My experience is that assessment is really filled with ambiguity and gray area. Like most counseling and most psychology, assessment is not a precise process, and professionals may disagree at times. And I think you'll see this in the classroom, which, if we're, for example, reviewing a client case file together, or we're reviewing a mental status exam video together, we may have differing perspectives on what the coding or the assessment should be for that. And I think that's okay. I think that's just part of, trying to assess something that's fairly nebulous or more of a gray area. I think this is because human experience is not easily measured. Counseling is not an exact science. If only it was. It's not a hard science. Like, for example, when you go to the doctor and you get a blood pressure reading, they know exactly what those numbers mean and what to do about that. Counseling doesn't have quite that kind of quantitative rigor, and so often we have to make decisions even based on numerical evidence, so for example psychological tests and self-reports, that is based on our own best judgment. And so I think new counselors struggle with this a bit, because when we're learning something for the first time, we really want to do it right, and we think there should be a right answer, and that's often not the case in counseling, and it's certainly true for assessment. In addition, counselors in training typically view the roles of counselor and assessor as two different activities. For example, new counselors will see the role of the counselor as more listening, understanding, validating, and assessment as being somewhat of a detached, very different job duty. And I think over time, you'll come to understand the two functions as actually being quite similar, because even when you're listening to someone quite deeply, you still have to make decisions about what they're saying is most pertinent, and which components of what they're saying to ask follow-up questions to start exploring further, to even start planning treatment around. And so I think over time in this course you'll see that assessment and counseling actually are quite similar, and central really to what you do in your work with clients. So why is assessment important? Well, I think there is a couple of things further that I want to discuss with you. The first is a metaphor I like to use, the midwife metaphor. This helps us understand why it's so important to know how to do assessment, even when we're working from a wellness framework, from a wellness model. This is how most counselors practice. We believe in holistic care. We believe that counselors are more than their diagnosis or pathology. We believe that we should appraise clients' strengths and help them work towards a more functional life using what resources they already have. So in addition to that, like a midwife, and we'll stay with the midwife metaphor for a moment, midwives also help normal, healthy women give birth to new life, and I think that's what we do as clients in a way, give birth to new life, help clients to do that. And good midwives should also know when there's a complication in the delivery, when there is something going on that needs more, you might say, intervention, more direct intervention. And this may require referral to a specialist, for example, to an obstetrician. It may also require a trip to the hospital if there's a home birth. It may require just a change in how the birthing process is going. And I think that that's a very useful metaphor for us to understand as counselors, which is absolutely we can operate from the wellness framework. And in addition to that, we should also be thinking about how we need to be aware of complications that can occur in the counseling process, and when there is a more significant issue, for example, severe psychopathology, that warrants either a referral or just a different way of going about treatment. So here are two examples, two high school seniors that will help to explain why I think assessment is so crucial. In the first example, I had a high school senior who was struggling with ADHD. And he didn't know it at the time. His family didn't know it. He had not been diagnosed. He had come to me because he was failing in school. He had horrible grades in school. And he was getting close to graduation. He began seeing me towards the end of the fall term, just before winter break. Now, when he returned from winter break, I had asked him how his winter break was and expected him to tell me all kinds of things he got up to. His response was, I pretty much just stayed in my room and didn't do a whole lot. And I thought, that's strange. That almost sounds like depression, but he wasn't depressed. So I wondered, what's that about? And I started thinking and wondering more about that and asking him some questions. And it became apparent that he was someone who daydreamed a lot, had difficulty focusing, and was very focused on video games. And it became apparent the more I asked those questions, I actually pulled out the DSM and reviewed the ADHD criteria with him, that he did indeed fit the criteria for ADHD. I made the referral to a pharmacologist. He was prescribed medication. And it's actually a very warming story, because within the next few months he had taken a stimulant and his grades had dramatically improved. In fact, he graduated from high school and was going off to college by the end of our time together. So that's one example of how important assessment is and being aware of these complications that can occur. The second was a high school student who was completing online education to finish his diploma. He had moved from out of state, and something was going on with him that just wasn't right. I couldn't put my finger on it. And I just kept asking questions about how he was doing, what kinds of symptoms he was having. And I think by the fourth or fifth session, he had told me that at times he hears voices. And again, major red flag. Wow, he was experiencing hallucinations. We needed to address these. And so asking those questions, wondering, listening to your gut, knowing when something isn't right, those are very, very important to treatment. If I hadn't have done that, I may have completely missed the fact that he was experiencing voices. And if I hadn't have addressed that, we would have missed a major core component of why he was struggling in the first place. A couple of other things about why assessment is important. As a counselor, you will have to diagnose clients. This is not an easy task. In fact, as counselors, you'll often feel conflicted about making a diagnosis. And to make an accurate diagnosis, using assessment is really critical, especially things like the mental status exam, which you'll learn during this course. Assessment is also important because it helps us track outcomes with clients. Outcomes meaning we want to know session by session how a client is doing. Are they getting better on the goals that they have, improving? Or are they declining? Are they getting worse? We need to be tracking this because we can prevent premature termination by clients if we're listening closely to any indication that the client is regressing, or any indication that they're just stagnating, they're not making the kinds of change in their lives they need to. There are ways to track the client's progress through assessment that are quite useful. Here are some other reasons about why assessment is so important. It is a misnomer, it's unfortunately not true, that counselors are just not good at assessment, just not good judges of clients. I think part of the reason for this is counselors want to think positively about their clients. They want to have faith that they're capable of making major life changes, that they're capable of making major growth. And I think that because we have such faith in our clients, it blinds us somewhat to the struggles they may be experiencing. And so because of this, we can experience things like early sensory-based assumptions and miss major issues the client may be experiencing. Here's a couple of actual examples. He was dressed nice, so I assumed he could read. That's a visual bias. He was articulate and interesting, so I did not suspect alcohol abuse. That's an auditory bias. You can see there how the way in which we perceive a client can bias how much we assess, and therefore it's important to be doing more structured assessments in addition to going with our gut, because our gut is not always accurate. Unfortunately, it's also not always true that clients are open and honest with us. Clients are not always open and honest with us, and sometimes they're not even aware of clinical issues they may be experiencing. Oftentimes, there are good reasons why they're not being open and honest with us. One example is trauma, which is clients have a lot of shame around disclosing, talking about what happened to them, plus they have avoidance symptoms, such as not wanting to talk about trauma because it may be re-traumatizing, or at least they fear flashbacks and things like that if they talked about their traumatic event. Second is substance use. And substance use, for example, if you're using a substance actively and you see a counselor, if you're going to mention that, you're probably going to be working on that. And so you may not be willing or ready to work on your substance use, and therefore you may try to avoid it or try not to be open and honest about it. And that's kind of understandable. Not everyone is ready to change, of course. But it's still important to assess clients and to have a frank conversation with them about maybe they're not ready to change, and maybe that's okay, and at the same time they may not be ready to make proper progress on all areas of their life, and it may also hold them back from making progress on other goals that they have, such as working through depression, for example, if they're using alcohol. You will also run into cases when the client is difficult to figure out, doesn't make sustained progress after many sessions, is making progress but still has a problem and seems difficult to treat and isn't receptive to counseling, or has received multiple rounds of counseling from other providers who felt that their services were of little benefit. When you have clients like this who, for example, aren't making progress, or they're making progress on one area of their life, such as, for example, depression, but they still have another major problem such as OCD going on, or that they've received a lot of therapy before to no benefit, we really should be doing a more in-depth assessment to find out what's going on with that client. For example, if we don't know a client has OCD, but we notice that there are these interesting behaviors that don't seem to be changing, we may want to, conduct an assessment to find out whether or not they have something that's preventing them from making major life changes. It's the same with when you have a client who's seen 4 or 5 therapists before you without benefit. You really should be doing a comprehensive evaluation of that client, otherwise you're going to be providing the same treatment as usual services as the other 4 or 5 providers, which already weren't of benefit to the client. They may need something more significant, such as medication or something like neurofeedback. There are also going to be cases where medical and psychological assessment can be incredibly helpful. And I think medical assessment, ruling out medical cause, or organic cause sometimes as it's called, is a very important first step in the counseling process. When you have a client coming into you, one of your assessment initial intake questions should be, have you seen your primary care physician recently for your annual exam? If they haven't, it's worth them going and seeing a primary care physician and getting a full lab panel done. Because I can tell you from experience in the past, if a client has something like hypothyroidism, which is low levels of the thyroid hormone, it may cause them to have symptoms that seem very similar to depression. Low energy, low mood, difficulty with sleeping too much, difficulty with eating too much. All of those, having less interest in things they used to enjoy, all of those key symptoms of depression can look just the same as if they were depressed. And here's the thing, if you have a client come into your office and saying, I need help with my depression, and you don't get them medically evaluated, then you may work on the depression for months and they make very little progress because it's biologically based. So I think medical assessment is very important, and you should know, and we will go over in this course, what to be aware of in terms of potential medical issues. It can also be quite helpful to use psychological testing at times, more formal psychological tests. One example is sometimes it's quite difficult to tease apart ADHD from bipolar disorder. They both have core symptoms of impulsivity, hyperactivity, and you may miss some of the nuances of, for example, whether there are mood episodes or not. That's really what differentiates ADHD from bipolar disorder. So it can be quite useful to use psychological testing to determine what's really going on with a client. So I've given you a bit of a rationale for why assessment is so important. Next, I'm going to talk about the relevance of this course, why this course itself is important in your learning of assessment as a core skill. It's important to determine the relevance of a test result. Regardless of whether you ever administer a psychological test or not, or even if you conduct a clinical interview or not. Let's say you're a school counselor, for example. It's very important to understand first that assessment findings are usually a point-in-time snapshot. So for example, if a client seems to be having significant depressive symptoms today, that doesn't mean they're going to have them 2, 3, 4 weeks or months from now. And so understanding that a person is not, for example, a depressive person throughout the lifespan because of one test is very important, because often the way reports are written, it's almost like a lifetime diagnosis, and that's not always true. We also want to ask ourselves whether a test is appropriate for the client, for whether or not, for example, the client is of the reading level or has the language ability. For example, they may be non-English speaking or English as second language, whether or not they really understand the test. We also want to be asking if the test is helping to answer the right questions. So, for example, if a client is struggling with certain issues, we want to make sure that the test that they're given inquire directly about those issues rather than something else, because that may not give us the kind of information that's helpful. So, understanding those themes are very important as a counselor, even if you're never actually going to administer and use assessments yourself. Test results, of course, can have a big impact on the lives of our clients, positively and negatively. Let's take a little look about that. I think it can be very helpful to understand the power of data as a counselor. Most people, counselors included, put more faith in any piece of information when it has numbers or some data behind it. All of a sudden it legitimizes that feedback. That is especially true for psychological testing. So if you are reading a test report that contains information about progress or positive outcomes, it can, positively, change the way people think about a treatment or a program. I've experienced this personally. I've had, for example, clients look at an outcomes rating scale and realize, I have made significant changes, and buy more into the counseling process. Or I've also been part of a program that implemented DBT, and the program staff didn't fully buy into DBT until they saw through quantitative feedback that the patients were actually having symptom reduction, that was quite effective for them. And then they really started to buy into it because it was better for the patients. Okay, so negatively, in addition to this, test results again can have quite a lot of power in how we view ourselves. And if a report contains diagnostic information without strengths, or even sometimes with strengths, clients may tend to focus on the worst aspects of a report. And it's important to understand this as a counselor, because when you're working with a client, you want to address this directly and ask during and afterwards, how are you feeling about yourself? How are you taking in this information? Because unfortunately, clients can sometimes take pieces of information and run with them and start to think quite negatively about themselves, which is really the opposite of what we want. We want them to be informed so they can make empowered choices. And just to kind of review the human nature of this, if a report contains 9 positives and 1 negative, many of us tend to focus on that 1 negative. Now, why is this? Why do we do that as people? Well, I'll leave you to think about that. When conducted correctly, assessment can in itself be a therapeutic intervention. What do we mean by this? Well, if you use assessment findings as a conversation starter, it can begin the exploration process about what those findings mean and how does it impact how you can modify what you do, or maybe have more faith in your own abilities, for example. In addition, testing can have somewhat of a placebo effect, like I've talked about before, because of the value placed in objective data. Clients can perceive counseling as more meaningful and the counselor as more effective, trustworthy, and attractive on the basis of receiving feedback through data. On the flip side, clients also can tend to abandon or lose investment in counseling when the counselor underestimates the severity of the problem. An example would be when a counselor does not assess, fails to ask about substance use, and a client does indeed have a substance use problem. They will either think that they're conning the counselor and then they're not savvy enough to get it, or they may just feel like the counselor just isn't asking the right questions, doesn't really understand what they're going through. Okay, so I've talked about why assessment is important and why this course is important in your learning of assessment. Next, we're going to talk about assessments that are explored as part of this course. Assessment is, of course, an umbrella term that includes a lot of different means of assessment, such as interviewing, behavioral observation, and this can be in session or otherwise, such as my classroom example from earlier. Questionnaires or instruments, more formal, structured kinds of assessment tools. Role-playing, and also portfolios, which is more common to academic assessment. There are thousands of assessments that exist out there. The assessments that we're going to explore in this course were selected on the basis of their practical application. What do I mean by this? Well, you will learn to use assessments commonly used by counselors in clinical practice. I think it's most important that you understand those assessments, those ones that are foundational, that most counselors use, that are really important to understand and be able to use in your own practice. You will only read about assessments that are uncommonly used by counselors in clinical practice. Either you need additional training for them, or they're just not commonly used today because, for example, they take too long to administer. Those kinds of instruments we're not going to focus as much on because I want you to have a foundational understanding of the most important assessment tools. So here are the assessments we're going to explore in depth as part of this course. The mental status examination, outcomes and session rating scales, the mini mental state exam, which sounds quite similar to the mental status examination but is different, easily confused, the adult attachment interview, the Minnesota Multiphasic Personality Inventory, the Beck inventories for anxiety and depression, and some simple projectives such as the sentence completion test. These are assessments that mostly you're going to read about, and we may explore them in class, but we're not going to spend a lot of time on them. The Milan inventories, the 5-factor inventories, the Myers-Briggs type indicator, which actually is very commonly used by counselors but mostly for career-related assessment. Intellectual assessments, which mostly are used by psychologists and school psychologists. Aptitude and achievement testing, such as the Woodcock-Johnson. Projectives, such as the Rorschach and thematic apperception test. And neuropsychological assessment. That concludes this video lecture. We've explored in this video lecture the importance of assessment, the relevance of this course, and the assessments we're going to explore as part of this course.